Home Group are a large organisation that work predominantly in housing, supported housing, regeneration. We've more recently started to develop our specialist services provision. What will be of interest today is the fact that we're moving more into mental health, specifically step-down services. We have a really good offer around step-down. We're very interested in how we can bring together health, housing, social care by integration.
And I think particularly in terms of helping the NHS as a wider organisation focus on things like prevention of admissions and early discharge. We're aware that for our inpatient units, for our large mental health trusts, they're a really big problem. So one of the things that we really want to do is to help to focus on how we can prevent people from being unwell enough that they would be admitted to hospital, or help them in terms of getting out of hospital quicker. We know that the longer people stay in hospital, it doesn't do their mental health good in the long run. We want to move away from that institutional care, and we want to be able to build stuff that's in the community. And for us, it's not just about that physical buildings in terms of housing, but actually in terms of the care that we provide while we're in there. So some of what we'd be looking for would be about how we can bring in some of the physical healthcare and really integrate that into what we're doing, so that moving away from that very traditional supported housing model where we would offer help with appointments and form filling in a housing environment, whether that be in somebody's own home or whether that be as part of a wider approach, but also about looking at something that is, as I said, integrating that physical healthcare, but as well as skilling our staff up to provide psychologically aware interventions that are evidence-based, so that they can have really informed conversations with our service users that helps them on their journey to recovery, really starts to create hope, starts to create that independence, moving away from a paternalistic model, and really starting to get people to take charge of their own mental health and their own pathways as they're going forward. I think it's an opportunity to network, in terms of getting an understanding about who else is out there and really getting a feel for it, making sure we're on track, really helping us sort of reflect on our journey in terms of how we're matching up with a 5-year forward view for mental health, and really looking to kind of reflect on where we're going in terms of our journey. But it's also a really good opportunity to interact with other people. We're very much about co-production, so part of the way we want to deliver our services is about doing that in alignment with other people, looking at partnerships, and coming here and mixing with other people from third sector and from the NHS and from the private sectors, which gives us a really good opportunity to help develop something that's really robust, so that we're not going with that single mindset.
Although we have had some interesting conversations around, as Fiona mentioned, co-producing services, working with people in partnership, so that we respond to local need in a local community. We do have had some really interesting conversations around our step down product and how it can be used, how it can be enhanced. We have a great exemplar service in Homeview, which is a step down service that we run in partnership with a local foundation trust, where we have fairly complex clients with mental health needs.
And that environment provides a short-term intervention where we're looking at, again, it's focusing predominantly on early discharge, but also can work on admission prevention, has really close links with crisis home resolution teams, mental health teams, also has really good working relationships with inpatient staff themselves, and really getting to a point where we can actually pull people out of hospital. So we're actively working with the nurses and occupational therapists on the inpatient environment to say to them, is there anybody who would be suitable for this service? And again, working really closely with the commissioners. They're really quite passionate about that service. And for us, it's about bringing in that whole systems approach. So as well as the psychological awareness that I was talking about and the physical healthcare, it's also about bringing in those social elements. Is that it's much easier for the people we're working with if they have somewhere to live, if they have somebody to help them in terms of accessing employment and training. So we've got some things like our home achievement programme, where we'd help with people who maybe going on to an NVQ is a big step for just now. So our home achievement programme would be modules they can do within any of our properties, supported by staff, where they can start to look at anything from recovery and peer mentoring through to financial management or healthy eating, and starting to look at some of that self-directed study. And again, it's about taking that ownership, really start to have hope for the future, start to set goals for themselves. And that's where we'd really start that process, you know, within environments like Homeview, and we've got other services like that internally. I think for us, the conversations that I've been most interested in has been about the community-wide. So we start to talk about some of the properties where we might want to explore how we set up a whole community. And I've really liked the fact that people talk about communities a lot. Yeah. Housing is much more on the agenda. We're in a really fortunate position in the sense that we can provide properties as well as that service. But for us, it's about how we interlink with those others to create those true partnerships, so that we're getting to a position where we could potentially have GPs, we could have employment opportunities, we could have health and leisure in there, so whether that be mindfulness or whether that be talking therapies, but that they're there to access, to start to break down some of that stigma, so it starts to become part of the way that our communities and our services run. So we start to have a look at how we can build up resilience within those communities and look after each other.
We've enjoyed today's conference a lot, haven't we? I think the speakers have been really interesting. I think it's really important to share those high-level topics, and then people can reflect on how it links with their own agenda and how we can connect. I think specifically one of the things that hit home for me was one of the speakers discussed evidence-based practice, and the need for us all to work together to develop that in and around mental health. That was quite important. I think having the opportunity to come together as a group of individuals who are passionate about mental health is unequivocally important, and we would want to continue to support that.
Yeah, I would agree with that. Between us, we've got about 30 years of NHS experience as clinicians, and it's really nice to hear people still banging that evidence-based drum. And for us, that's some of the things that we want to bring into the services that we provide. And you can see it around the other third sector areas, they're doing exactly the same. You know, there's lots of passion about really aligning what we're doing with that national strategy.
I really enjoyed the speaker that talked about workforce, something that we're very passionate about, and it was quite thought-provoking in as much as where does the future of mental health workforce lie, and does it wholly lie in acute or community healthcare settings if people are living and returning closer to home in communities? I won't go into more detail than that, but I thought that was very interesting. That was my personal highlight, and it's got me to reflect a lot on where the future lies and the opportunities where home group can support.
For me, I think it was around a conversation I had just with another delegate talking about, she's here in a professional capacity, but she also talked about her daughter having mental health problems, and when I was talking about what we would offer within home group, and she was reflecting on the opportunity to marry together property as well as support, and how for her daughter that would be really beneficial. And as a nurse, it's something that resonates with me. I'm very driven by my values, and to have something where you feel like you're making a difference to one person or to 1,000 people, that's what really drives me. So it's just nice to hear that what we're doing is on the right track, and that we're going to make a difference for people and help them with their recovery, help them with their independence.